Hello everyone, welcome to the ENT corridor. In the past few lectures, we have discussed about the cartilages, ligaments, membranes, and spaces of larynx. So in part 4, we are going to discuss about the muscles of larynx. Like the ligaments were of two types. We saw that the intrinsic ligaments as well as the extrinsic ligaments, right? Similarly, the muscles are also divided into two groups, the intrinsic group and the extrinsic group. We'll get to know why they are called as intrinsic and extrinsic. Now, intrinsic are further divided into three different types. Okay, the adductors, the abductors, and the tensors. Okay, quite easy. The adductors, the abductors, and the tensors. Okay, so what are the muscles that come under adductors? Are lateral cricoarytenoid, thyroarytenoid, and interarytenoid, whereas only abductor of larynx. This is a viva question for UG people rather than PG. Okay, is posterior cricoarytenoid and only tensor. This is also a viva question for both UG as well as PG. Is cricothyroid muscle. Okay, so the intrinsic muscles are divided into three broad categories: the adductors, the abductors, and the tensors. Okay, the adductors are lateral cricoarytenoid and thyroarytenoid and interarytenoid, and abductor is posterior cricoarytenoid and tensor is cricothyroid. Now it's very easy to remember the origin and insertion about this muscle, similar to ligaments. Like we saw how ligaments are originating and inserting. Similarly, muscles will also originate and insert in according to the name itself. Okay. So it's very easy to remember. I have shared the table over here so you can get everything in a concise manner. So first muscle, let's focus on the first muscle. It is cricothyroid. So something to do with the cricoid and something to do with the thyroid. So let's see the origin from the anterolateral surface of cricoid cartilage. Okay, so crico, it is originating from the cricoid cartilage, from where the anterolateral surface of the cricoid cartilage, and insertion. So the next half, the second half is thyroid. So obviously it gets inserted into the thyroid cartilage, where to the lower border and the inferior horn of the thyroid cartilage. So this is easy. So from the cricoid, it is originating and into the thyroid, it is getting inserted, right? And let's see a diagram. You can see this diagram. So the cricothyroid muscle, okay, the cricothyroid muscle is further has two parts. Okay, what are the two parts? It is called as pars recta and pars obliqua. This is just for PG people, not that useful for UG. Okay, you can see this is the cricoid. Okay, this is the cricoid and this is arytenoid. Okay, and this is nothing but the thyroid. Okay, so here you can see the fibers of cricothyroid muscle. They're originating from the anterolateral surface of the cricoid and they're getting inserted into the lower border of the thyroid as well as the inferior horn of the thyroid. Okay, so imagine this getting contracted. Okay, this getting contracted. So what does this do? It will pull the thyroid. It will tilt the thyroid a bit. Okay, so it is changing. So it is changing the so it is changing the diameter. Okay, it is changing the diameter of the thyroid. Okay, it is increasing as well as decreasing the anteroposterior diameter of the thyroid. So as usual, it will affect the pitch of the voice. Okay, so let's see what its function is. So let's focus on the function. So the main function is tenses and lengthens the vocal cord. How? Because it is having its effect on the thyroid cartilage, and the vocal cord is attached on the thyroid cartilage. So due to the movement of thyroid cartilage, there is a lengthening of the vocal cord which increases the pitch of the voice. Okay, high pitch voice. And this is a viva question. All the muscles are supplied by recurrent laryngeal nerve except cricothyroid, which is supplied by this external laryngeal nerve. This is a viva for both UG as well as PGs. Okay, I hope this one is clear. Okay, so cricothyroid is finished. Okay, now next, second one is posterior cricoarytenoid. Again, let's cut down into simplified manner. So posterior, something which is attached on the posterior surface. So cricoarytenoid, we have two words. So cricoid say origin or arytenoid may insertion. Okay, so it is originating from the posterior surface of the cricoid lamina. If you remember the cricoid cartilage, I have talked about a cricoid lamella. You remember the posterior surface, it had like this a quadrangular shaped lamellus, right? Two lamellus. I have shaded with green also. So this is the posterior surface and this is the lamella, and again you have the arytenoid sitting on the top. This is the vocal process of the arytenoid and this is the muscular process of the arytenoid, which I have already talked about. So when you're talking about this muscle, okay, this muscle is originating from this posterior lamella and it is going and getting inserted into this portion. Okay, let's make it more clear. I'll just draw a clear picture for you. Okay, so this is the posterior lamella, this is the muscular process, this is the vocal process, and the muscle is going and attaching over here like this. Okay, posterior cricoarytenoid muscle. Now imagine it getting contracted. So when it contracts, what happens is the space increases and it leads to abduction of vocal cords. Okay, it leads to abduction of vocal cords. You can see this diagram over here. Posterior cricoarytenoid. This is the lamella, posterior lamella that I have been talking about. Okay, only abductor of vocal cord, which means opening of the vocal cords, which will help in breathing. Okay, and it is supplied by recurrent laryngeal nerve. Okay, now the next muscle. Let's focus on the next muscle, the third muscle, which is nothing but lateral cricoarytenoid. Okay, lateral, something from the on the lateral surface. Cricoarytenoid. Okay, so it is originating from the upper border of the cricoid arch and it is getting inserted into the muscular process of the arytenoid. In previous diagram, I have already shown you this, but again, I am going to show you. Okay, so you can see the brown fibers over here. Okay, this is the muscular process. This is the vocal process. This is the cricoid. Okay, and this is the lateral surface of the cricoid. It is originating from here and it is going and attaching into the muscular process. So when it contracts, okay, when it contracts, the whole arytenoid moves outwards. But here, as you can see, this portion, the vocalis muscle, it moves inwards. Okay, okay, this causes adduction. Okay, adduction of vocal cords. Okay, this is causing the adduction of the vocal cords. Let's see. Okay, so it is causing the adduction of vocal cords and it is also supplied by recurrent laryngeal nerve. Okay, now we have two interarytenoids. The interarytenoids are further divided into two. As you can see in this diagram, you have a transverse interarytenoid and an oblique interarytenoid. Okay, you can see the red one is a transverse interarytenoid and the brown one is an oblique interarytenoid. Let's see the origin and insertion of this. The transverse arytenoid, it is from the posterior surface of one arytenoid to the opposite surface of the opposite arytenoid, right? transverse arytenoid is from one arytenoid to the next arytenoid, whereas the oblique is from the muscular process of one arytenoid to the apex of the opposite arytenoid. Okay, so if I draw two arytenoids, this is the apex and this is the muscular process. So it's like this basically. Okay, it's like this. Okay, clear? I hope this is clear. Okay, so what is the main function of transverse arytenoid? It closes the posterior rima glottis, and we'll talk about it later. And oblique is it adducts the arytenoid and helps closes the laryngeal inlet. Okay. Now, vocalis muscle or the thyroarytenoid muscle. Let's focus over here. The thyroarytenoid is divided into two, the internus and the externus, or the medial portion and the lateral portion. Okay, whatever you want to call it. Okay, the median one or the midline one, it is called as the vocalis muscle. I want you to focus on this. Okay, so this is a thyroarytenoid muscle. This is the cricoid. Okay, this is the thyroid. Okay, this is arytenoid. This is the muscular process, and this one is the vocal process. Okay, and this area over here, it is nothing but the anterior commissure. Okay. Okay, so the blackish thing, this blackish thing is nothing but the vocalis. Okay, the blackish one is the vocalis muscle, or it is nothing but the internus, or it is also the median fibers of thyroarytenoid muscle. Okay, whereas the brownish one is the externus or the lateral fibers of thyroarytenoid muscle. Okay, clear? Okay, so let's come back. Now, what is the origin of the vocalis muscle? It is the anterior commissure. Insertion is vocal process of the arytenoids, and action, it makes the vocal cord short and thick. Clear? And it is supplied by slow twitch. Right, so this is not that important. Now, what is the lateral one or the externus? Lower half of the thyroid cartilage, it is getting its origin from. It is getting inserted into the base of the arytenoid cartilage. Okay, this is about the thyroarytenoid muscle, about the vocalis muscle, whatever you want. Now, this is one very quick important tips for you. All intrinsic muscles are supplied by recurrent laryngeal nerve except cricothyroid, which is supplied by this external laryngeal nerve. All are adductors except posterior cricoarytenoid, which is the only abductor. Okay, now when they ask about the muscles, you also need to write about the extrinsic muscles of larynx. These extrinsic muscles of larynx we are going to discuss in detail when we talk about neck. Okay, so I have just given a small table about the extrinsic muscles of the larynx, so you can quickly memorize this table, but we will talk in detail when we are going to discuss the neck. Okay. Now, one very important thing for PGs actually, not UGs, because UG is very hi-fi, I guess this portion is. So vocal fold histology is very important for PGs. So what are the layers in the vocal cords? Okay. So starting with the first layer, the outermost, you can see the creamish color layer, that is called as the squamous epithelium. Okay, this is a cut section of your vocal cord. This is actually the brownish thing which you are seeing is nothing but the vocalis muscle. Okay, I think you're not able to see properly. Okay, so this is vocalis muscle. Okay, which we just saw right now, the thyroarytenoid. Okay, so above this vocalis muscle, what do we have? So the first layer is squamous epithelium. Okay, then we have the basement membrane, Then we have the superficial lamina propria, which is called as Rinke's space. This is very, very important for UG also, because you have a question which is called as Rinke's edema. So to know what is Rinke's edema, you need to know what is a Rinke's space. Okay. Now, what is vocal ligament? Many of us get confused. What is vocal ligament or what is vocalis muscle? So, vocal ligament is nothing but the third layer, which is further divided into two. That is nothing but the intermediate lamina propria and deep lamina propria. And the fourth one is nothing but the vocalis muscle, which I told you about. This whole red thing is nothing but the vocalis muscle. Okay. Now, let's see in detail, because this is very important for PGs, not that important for UGs. Okay. So the first layer is stratified squamous epithelium. Okay. Now this layer is highly metabolically active layer. Okay. This is very metabolically active, and there are new cells that are coming, and the old cells which are there, they also shed off. If you see, surface cells slough off and new cells come over the surface cyclically. And what is the function? Okay. This is the function of this layer. What is the function? It maintains the shape of the vocal cords. Okay, this is a function. Now, it is not like directly you have the stratified squamous layer, the two layers above it, okay, which is nothing but first layer above. You can see the bluish one. This is first layer, and this is second layer, and the third layer is stratified squamous epithelium. Okay, so what are these two layers? So the first layer is luminal layer, which is thick, and its function is to prevent dehydration, whereas the serous layer is thin and it has the highest water content. Okay, the main function of these two layers is to keep the vocal cords moist, okay, and prevent it from getting dehydrated. So above this stratified squamous layer, there are two layers, okay, above it, and then comes the stratified squamous layer, and below it we have the basement membrane. As usual, every layer sits over a basement membrane. Okay, now what does this basement membrane have? It has protein as well as non-protein substance. Okay, it has protein and non-protein substance, and this is a viva question. What type of collagen does it have? It has a type 4 collagen. Okay, and what is the function of this basement membrane? The function of basement membrane is to provide structural support. Okay, so we have seen about this stratified squamous epithelium. What did we see? That it is metabolically active, its function is to maintain the shape, there is a new cycle of cells coming up every time. Okay, there are new cells coming up, and the old cells, they get sloughed off. And above stratified squamous epithelium, we have two layers, the luminal layer and the serous layer, and their function is to keep the vocal cords hydrated and to prevent it from dehydration, right? And then we talked about the basement membrane, and what is its function? It is to provide structural support. Okay. Now let's talk about the Rinke space. Okay, for UGs, I just want you to focus on this Rinke space because it is important for you. Okay, in Rinke space, what does it have? It has both fibrous as well as proteinaceous components. Okay, the fibrous product which is there, it provides strength, that is the function. Okay, and proteins like hyaluronic acid, dacron, or persion, what do they do? They absorb shock. So whenever you speak, whenever your pitch is not correct, okay, all these produce trauma to your vocal cords, right? So this layer acts as a shock absorbent. Okay, this is the function of the Rinke's space. Okay. Now the third is the vocal ligament, which we talked about, and we also saw that the intermediate one and there is a deep one. So intermediate is more, it is comprising more. Okay, suppose it is comprising like 3/4 and this is comprising only 1/4. This is just an example to explain you that the intermediate is more than compared to the deep lamina propria. Okay, and we talked over here, basement membrane is comprising of type 4 collagen, right? Similarly, the intermediate layer is comprising of type 3 collagen, and the deep one is comprising of type 1 as well as type 3 collagen. Okay, so this is everything about your vocal cord histology. So this is all for part 4. Let's talk about the nerve supply in part 5.